Hello out there in television land. Welcome to yet another edition of It's Your Health. I'm here with my son, the Fipster, and we're going to inform you and entertain you over the next fastest 30 minutes in television history. Make sure you check with your healthcare provider before doing any of the things that we talk about here on It's Your Health. We'll be right back after this brief commercial message. Remember, you're watching It's Your Health, your leader in healthcare information. Be right back. Welcome back for the first edition of It's Your Health. I'm here with my son Fipster, and we got a lot to tell you about. And hopefully spring is in the air. I don't know about you, Fip, but it's been a long, hard winter.
This time last year I was golfing quite a bit, and this time this year it's passing fantasy.
I see.
So we need to get back in the swing of things. Let's start off with some headlines, shall we?
Alrighty.
Diet drinks as mixers make for stronger cocktails. Have you ever heard of this?
Never. Why don't you enlighten us?
Well, often people drink diet soda to mix, with their rum and Diet Coke or so on, or Diet 7-Up, Diet Ginger Ale. And it turns out that cutting back on those calories actually has an effect to strengthen the effects of the alcohol. They did some studies where they took people with regular soda mixed with alcohol and diet soda mixed with alcohol, and sure enough, the people who mixed the diet soda had higher breathalyzer tests 40 minutes after they drank versus the ones that didn't. It turns out sugar or calories that are in your bloodstream delay the uptake of alcohol in the brain.
Oh, that's interesting. So candy's dandy, liquor's quicker, and if it's diet soda and liquor, it's even quicker yet.
Be careful. All right, moving on. The FDA approves the first over-the-counter remedy for overactive bladder.
Boy, we certainly see a lot of this overactive bladder, particularly in postmenopausal women. Perhaps they've had injuries from childbirth or whatever, and that overactive bladder is a big issue. And having a patch that would take care of that is certainly a godsend. Some of the side effects?
It's the same as all the real, in fact, this was a prescription patch at one point. It's the same as most of the other medications out there. Dry mouth, dry eye, constipation, these are the things we have to watch for, and that's kind of the effect of these medications. Just about everyone does it, to some extent more than others, and so it's something still being over the counter. It is something you should discuss with your healthcare provider first before trying.
Yeah, because you can still have a significant drug side effect if you're on other medications as well. Good point, Phil.
Moving on, the FDA approves a skin patch for migraines.
I haven't heard of this one. Tell me more.
This is, again, migraine medications, it's really not so much about the medication anymore, it's about the delivery system. We have intranasal sprays, we have injections, we have Star Trek over-the-skin infusers that bullet the medication into you. We now have a patch that's a battery-operated patch that basically puts Imitrex, which is the generic would be sumatriptan, and pumps it right into your skin. I'm not sure, it's pretty new. I'm not sure the efficacy as far as why this delivery system is better than others. I assume it's probably because you have less nausea associated with it, and a lot of people with migraines do have nausea, so it's a great delivery system to get past that.
Right, no doubt. And of course, if you have migraine and you suffer out there, you know that you have the nausea and sometimes vomiting, so you can't rely on a pill. And so the patch may be your answer.
Right, and a lot of these people ended up at the ER getting injections, so I think it's helpful that we're finding different methods to try to prevent us getting to the ER.
Good point.
Let's talk about something that's been a real problem this time of year. We see people that they came in for an antibiotic in the beginning of the year, and they call 2 or 3 times. I'm still coughing, I'm still stuffy, I'm still this, I need another antibiotic, I need another antibiotic. And we get on this train of using multiple antibiotics, or at least desire them. You have some comments on that?
Right, well, sometimes it's just a virus that hangs around, and what a lot of people don't recognize is that these viruses can linger, if you will, for weeks on end. And you may still have symptoms of cough and congestion even though the infection is pretty much cleared. It's similar to a jet plane that goes overhead. The jet plane is long gone, but you'll see that vapor trail for days afterwards. And so if you have a cough days to weeks after an infection, it's not too unusual. We may just have to give you some cough medicine. And even though you're getting better, your body is still slow to recover. However, that being said, there are some signs that you should look out for that signal to us that perhaps something else is going on. Take a look at this list. Maybe you can comment on it, Phil.
Well, the things that we have to watch out with cough is, are we bringing up brown or bloodied or blood-filled sputum? Even streaks of blood is a problem, and that's something you definitely have to get checked out. Do you have fever? Do you have chills? That shows a more active infection, okay? Do you have body aches? That shows that there's potentially a more active infection going on, or there's a bigger problem. Did this cough all of a sudden come out of the clear blue sky, or versus has it been lingering for a while? Are you out of breath or wheezing? These are big concerns as well. And lastly, are you hoarse or having difficulty speaking or can't get your voice out properly? These are some of the things that can be a little bit more alarming and mean that there might be something bigger going on, and it's definitely worth getting checked out.
All right, good point. And of course, this past year we've had our share of viral illnesses and flu-like illnesses, and so I'm sure that a lot of out there have suffered from cough and congestion. So
I call it the Hazelton bug. It sticks around for a couple of months. So, and that's what we've been seeing.
The greater Hazelton area bug. Don't forget our
go.
Junedale and Tresco friends.
I forget
out
about
there.
them. That's true. Okay. They don't come out in the winter, though. Lastly, let's talk about one interesting thing that is a very interesting article we read over the past few weeks, and talk about statins. Statins, as you know, are the cholesterol medications, the main powerhouse medications that tell your liver really not to make cholesterol. And they're not without their charm. We do run into side effects, muscle aches, pains, but there's been some alternatives now to the way we use statins. Not so much whether we use them or not, but how we use them.
Right. Well, the statins, the Lipitors, Mevacors, Pravocols, Zocors, those are medications that lower your cholesterol. Major side effect that we generally run into is my muscles ache, and they don't want to take these medications because their muscles, not necessarily their joints, but their muscles ache, and that's a known side effect of the medication. Turns out after you've been on a statin for about a month or so, you have what we call steady state mechanics. That is to say, you could skip a day. And that's what the essence of this article was about, that you could take a statin every other day, still get the same effect of lowering your cholesterol, but it should lower your side effect of these muscle aches or pains. We're not recommending you do it till you talk with your doctor, but the study suggests that taking them every other day can go a long way.
Yeah, it's interesting, both in primary and secondary prevention of heart and stroke-related things. It shows that it does decrease those risks. And you have to remember, if I missed my cholesterol pill this morning, my cholesterol is not going to be up today. Unlike something like a blood pressure pill, where if I miss that today, my pressure is going to be up.
Exactly.
It takes a while. It takes weeks for your cholesterol to come down after starting a medication every day for it. It's going to take a couple of weeks for it to come back up. And so once we kind of get that real nice steady state, it's hard to kind of rock that boat. And this shows that we can still get some pretty good reductions. We don't have to increase the dose. And it did show that it did cut down on some of the side effects, specifically the muscle aches and pains.
Right. And again, getting your LDL, which is your bad cholesterol, at 100 or below is what the goal is. The interesting thing is if you can push it below 100, and the magic number there is 70, you actually get regression of disease. You can actually suck out some of the hardening of the arteries that have come out over the years. And we've seen that because we check carotid ultrasounds on people and we push their LDL below 100 and we repeat their carotid ultrasounds, these plaques seem to disappear.
Yeah, as long as there's not some other risk factors like somebody smoking or has other, other problems. But there are some times we can get these things to shrink down or certainly stabilize.
Speaking of disappearing, we're going to disappear for the next minute or so as we take this brief commercial break. Remember, you're watching It's Your Health, your leader in healthcare information. We'll be right back. Welcome back to the second segment of It's Your Health, moving right along, the fastest 30 minutes in television history.
Let's talk about some headlines.
Oh, okay, good.
I think this was a very interesting headline, and we're going to talk about it a little bit later in the show as well. The association between midlife cardiorespiratory fitness and later life dementia.
Yeah, it sounds intuitive to me that if you're healthy and doing a lot of huffing and puffing exercise, that you're going to have less of a dementing illness enter your life. Is that pretty much what they're saying?
That's the main gist, and that's really the key. Is it's not so much about general health in the sense of that, as is my weight corrected, but it's more about your ability to exercise and tolerate exercise. And then we show that people who have a higher level of fitness, not only in the early life, but specifically in that midlife area, and we'll talk about those numbers a little bit later, but by keeping the people who are fitter, the people who are joggers, the people who exercise, the people who stay fit, they have a much less chance of getting dementia later in life than the ones who don't. And that has nothing to do with stroke or heart attack. Those are all independent things. This is just purely they looked at dementia.
And it goes back to exercise is the trump card out there. And it's a little discouraging because we have 6 months of winter in northeastern Pennsylvania, so it's hard to get out there and huff and puff.
Well, that's why you got to get out and you got to get to a gym. You got to get into, have some fitness equipment at home. And it is what you make it. If you're not doing it, it doesn't happen.
Right. Good point.
Moving on. Global life expectancy increased nearly 20% since 1990.
Yeah, that's not surprising because when we go through our hospital rounds, ages 85, 90, we actually had a patient who had pneumonia, 105 years of age in the hospital, and she survived. So everyone is living longer. I don't know if they're living any better, but they're certainly living longer. Any further things to go on with that?
You know, I think it's interesting because a few years ago we reported that here in the United States the actual life expectancy actually came down for the first time, and yet now we're talking about how it's gone up. And I think the key to this article is global. We're doing a lot different things in different parts of the world, with vaccination programs, with underserved parts of the world. We're doing a better job of keeping those people healthy. It doesn't necessarily mean here in the United States we're keeping people healthier. We do a lot of things to kind of keep our health down, with our level of fitness, with diabetes, with obesity, and smoking. Whereas in other parts of the country, or world I should say, it's not as big of a deal. So, here in America, our lives are getting longer, but they're not necessarily more fruitful. And so it's about trying to extend our life in a fruitful way.
Quality of life. And again, going over our hospitalization ages, they're usually in the 80s and 90s. In fact, the emergency room, as a sidebar, called me and says, I have a 50-year-old in the emergency room. I says, wait, I don't do pediatrics.
That's right.
So,
colchicine in cardiology clinic, no longer just for the gout.
Yeah, colchicine, that time-honored medication when you had the acute gout, you'd take it and then you'd get some diarrhea and that would take the acid out of your joints and your system. Colchicine, of course, has gone by the way. It's now Colcrist. The drug companies tended to remanufacture it and boot up the price. But we're using colchicine now for cardiac conditions. Specifically, is it pericarditis?
Yes.
Tell us more.
Well, they've been able to show that actually colchicine is an interesting, almost anti-inflammatory drug. It's actually been used for thousands of years. The ancient Egyptians, I think, were felt to use some form of colchicine for different medical problems. But now it's a branded drug and will be for the next few years. But they're actually able to show that it does decrease the inflammation in the lining around the heart. Pericarditis, as you know, is an inflammation, not necessarily an infection, but an inflammation of the lining around the heart, and can cause quite a terrific amount of pain and discomfort, and is often mistaken as a heart attack. And usually we'll send someone to the ER thinking they're having a heart attack, when indeed it's just this inflamed lining of the heart. And it is treatable, and this is one of the ways we're starting to treat it now.
Good move. It just goes to show you that we can reinvent new uses for old drugs.
Well, let's move on. Speaking of new uses, old uses, let's talk a little bit about our fish oils and about which fats are good and bad for you.
Right. As we've discussed before, there's two types of omega fats that are available to us. The omega-6s, which are in generally most processed foods. These are inflammatory fats that tend to aggravate diabetes, hardening the arteries, and just makes any inflammation in your body worse. The most powerful braking system or anti-inflammatory out there are, of course, the omega-3s. Mm-hmm. And it'd be nice to get natural omega-3s, fish products, for example, certain oils. They will help any inflammatory process that you're currently experiencing. And if you can't get that, then of course we rely on our omega-3s that our pharmaceutically graded and distilled drug companies provide us. And these are terrific medications. I know when I miss them, the next day or two, you know, my muscles and joints and back hurt, and I'm generally pretty active. I'm out there cutting wood and loading wood, winter and spring and summer. So I really believe in these things. They're truly potent anti-inflammatories. Perhaps you could take us to the next level.
Well, you summarized it. You know, our stance on the omega-3s versus the omega-6 is pretty well understood, and I think that there's going to be more and more information about some of the powerful anti-inflammatory effects. I know people in the eye industry, you know, that's macular degeneration is something that is, you know, they're using the omegas for to help prevent and help treat, and there's going to be more and more data about that in the coming times. And so I think it's one of these things that, you know, we go back to kind of the old type of diets, you know, and this kind of gets us back into that and helps us get it, because it's not necessarily safe to be consuming fish products 3 or 4 times a week. That's hard to do with some of the way our fish population is undermined by pollution. You know, if we were eating, you know, quote, healthy fish 3 or 4 times a week, we would have mercury and arsenic problems. So we have to find a healthier way to eat fish, but not eat fish. And that's kind of the way to do it.
Right. And the Mediterranean diet, as I read things, is kind of close to getting omega-3s in your system as well. Speaking of prevention, we'd like to just go over this list of things that currently are recommended for adult immunizations. We always talk about childhood immunizations, but here's a list of things you should be thinking of if you're an adult. Phil, do you want to go through the list?
Now remember, adult is anybody from 18 to whatever, 105.
There you go.
And so some of these may be more applicable to our younger generations and some to our older generations, but let's start at the top and talk about the influenza vaccine.
Obvious, and of course we just finished the flu vaccine, and right behind it, of course, is tetanus and diphtheria.
Yes, that's something that's being, whooping cough is making a resurgence, especially in very young individuals. For adults who get whooping cough, it's not quite as dangerous. However, when we give it to our kids, it's certainly very dangerous, and so there's a resurgence to start vaccinating pregnant women and adults who are going to be around kids.
Shingles vaccine.
I think that we've talked about that quite a bit. That's the Zostavax. I think that's a very important vaccine. I believe over the age of 60. Talk to anybody who has shingles, and it can be a life-altering event.
HPV.
Human papillomavirus. I could talk a whole show about this, or what's called Gardasil. HPV, or human papillomavirus, is a viral infection. It is a type of STD, and these are not your grandfather's STDs where you took an antibiotic and you got better. These STDs stick around forever. They cause cancer. For women, it causes cervical cancer. That means a hysterectomy, and you're no longer having kids at the age of 25. For men, if you get this anywhere down below, we're talking increased incidence of penile cancer. For men who get this in their mouth, we've had actually patients get squamous cell carcinoma in the mouth. You know, that's part of your tongue being removed. You know, yeah. These things are spooky things. You know, the STDs today are spooky. And the Gardasil vaccine is one of these vaccines that can help us prevent from getting this virus. And it's, I think, an important vaccine not only for kids but for young adults.
Pneumovax, of course, is against pneumococcal vaccination. Generally, we give that in adult. Lasts generally 5 to 10 years. Sometimes we give boosters, but it's supposed to be lifelong. Moving right along, meningeal. Meningococcal vaccine, or Menimmune, Menoctra, whichever one we're using, especially in school-age kids going to college. You know, there's an increased incidence of meningitis in group living situations like dormitories. And meningitis, if you get that, you know, especially the bacterial kind, you know, that can be pretty deadly stuff. Be unforgiving, right?
And every year we hear of a couple of kids in Pennsylvania throughout the state school system who have had meningitis. At least we used to, but now it's a required vaccine.
Finishing up, Hep B.
Hepatitis B, that's something that now is actually given at birth. You know, the hepatitis A and hepatitis B vaccine, when you're born as a child, now it's a vaccine that is given. I do think that's an important vaccine. Hepatitis A is something that's a foodborne illness. However, hepatitis B, we get that through blood products, maybe a bad blood transfusion, IV drug use. You know, these are where we get these things, bad tattoos. So it's certainly worth getting vaccinated if there's a way to prevent it. That's a vaccine that's been out for quite some time.
Right, so you can really insulate yourself from the world's woes by looking at vaccinations. And what's disturbing is there's a pocket of people out there who are like so anti-vaccination persons that's why there's a resurgence of some of these illnesses. So
and it's neat, the person that really started the biggest anti-vaccine movement, it turned out he was working for a drug company, for another vaccine company, which is why he talked poorly about the MMR vaccine. It's a doctor in Britain. I believe he did some jail for it as well.
Follow the money. Speaking of following the money, we're going to take a brief commercial break, and we'll be right back with the third and final segment of It's Your Health. Remember, we're your leader in healthcare information. We'll be right back. Welcome back to the final segment of It's Your Health. Philip Benyo with Philip Benyo, bringing you the best in healthcare information.
Let's get back to some headlines. And my wife says she always has to tell me something twice, so I'm going to tell you something twice. Midlife fitness linked to lower dementia risk. Why don't you talk about it this time?
Exercise a little bit more and you might keep that dementing illness at bay. However, I'm reminded of several patients, not to rain on the exercise parade, but we have a couple patients who are actually joggers most of their adult life, and unfortunately they ended up in nursing homes with dementia. But you know, their heart and lungs are great. They're in their 80s and 90s, but again, quality of life issues we worry about.
That's like the smoker who ate bacon sandwiches. It was 100. You know, we only know one or two of those people, but most of them it's not the case. You know,
right.
Follow the data. Moving on, baby boomers' health worse than their parents.
Yeah, I think this is true. When we look back at the older generations, the ones that, of course, got us through World War II and the Korean War, these people have a lot less health problems than our generation, if you will. So what's the story here, Phil?
Well, it's very interesting. They called that generation the greatest generation. I think that still holds true because a generation has yet to quite live up to that, at least from what has been happened for this country and what at least the data shows. And I think if you look at a couple of these data points, it's very interesting. You know, the amount of alcohol consumption is 2/3 that for baby boomers versus 1/3 for the quote greatest generation. High blood pressure is more common now than it ever was. High cholesterol is more common. Obesity is more common. You know, I think if you look at a couple of these interesting data points, it's pretty wild that we're not, you know, we're a nation that's not quite as active, and I think that's what it comes back down to.
Right,
is that,
exactly.
You know, our TV has 500 channels, and I still complain there's not quite enough on there because I couldn't find anything to watch last night.
Jeez.
So that's a problem.
Yeah, you're right. We're just a softer generation. That might be a better way of putting it.
Literally and figuratively.
Right.
Last headline. Small snack portions are just as satisfying as eating the whole bag.
Yes, we've always talked about grazing, and a lot of people who are interested in losing weight, the way to do it is to eat. And it just not that you sit down for 3 big meals, but if you graze throughout the day, smaller, more frequent snacks, if you will, you tell your brain and insulin and everything else that runs our metabolism that you're not as hungry, and you start losing the weight and losing pounds. It's when you starve yourself that your body thinks that there's a famine or World War III, and it will shut down your metabolism and you'll never lose weight. So the way to lose weight is to eat. Maybe you want to amplify on that?
A little bit more often, the quote, hedonistic hunger, or people who eat for purely pleasure. You know, we think of back the old Greco-Roman era when people would eat for hours and days on end. That was about the food that was in front of them, not about the food they consumed. It was literally the act of eating that created some neurotransmitters in your brain to actually feel good about that. You know, it's once you've eaten it, those neurotransmitters are no longer being stimulated. So I think it's important to take a small stack, wait 10, 15 minutes, have a drink of water, and see if you're still hungry. More often than not, you will not be hungry, and you'll be just as happy. If you overeat, you'll definitely be sad. You know, we're going to talk more and more about screening for heart tests in the future and some of the tools that we have. There was a neat study that actually screened patients in the hospital for various medical conditions where they did ultrasounds of the heart to measure their ejection fraction, and they found that there was a relatively high prevalence of what's called asymptomatic left ventricular systolic dysfunction.
Big term, left ventricular systolic dysfunction. I cannot tell by listening to your heart if you have it. I can't tell by taking your blood pressure. But if you have it, and 1 out of 5 of you have it, by the way, if you do have it and it's not treated, you will go on to having what's called heart failure, which is irreversible and a little bit more difficult to treat. So the way we would screen for this would be with an echocardiogram. And if you do have this, treating you with a certain type of blood pressure medication will put you on a different track and hopefully avoid congestive heart failure, which of course this can be a major cause of. And then once you get heart failure, we're in deeper doo-doo.
Yeah, it's very interesting because we never really looked at how to prevent heart failure. We always talked about how to treat it, and the medications that we have are powered towards that. This is kind of taking echocardiograph or an ultrasound of the heart and trying to put it as a more handheld application, as opposed to anybody who's gone for an ultrasound of the heart. That's a big honking machine, you know, whereas now they're going to be developing smaller units that can be used at bedside or even here in the office setting to screen patients in a very quick method. To have your ejection fraction calculated, it only takes a few minutes, you know, it doesn't take long at all. And finding these people are in that 50% or lower range, if we get them on the right track, the right medications, you know, we can prevent heart failure in that key sense much later in life.
Right, we can forestall that. So we'll look forward to using that equipment. And if you're concerned about it, I'd see your doctor and maybe just bite the bullet and get a full echocardiogram and kind of see where you're at. Because I said 1 out of 5 of you have it and don't know it, which means we don't know it.
Let's talk about fancy, cool devices, and you know, I think you know, I try to stay away from watching TV shows about medicine. Of course, I caught myself watching The 600-Pound Man last night, and it was very interesting. But you know, I have some patients will come in and actually bring up things that they saw on an ER show or Dr. House, and you know, I think it's very interesting because you know, I watch that show, and that really is, that's fantasy there.
Well, it's almost like the crime ones, if you will. They take the level of expertise to a level that does not exist. And you know, Dr. House and those popular medical series, to do some of the things they do, make the diagnoses they do, and treat them the way they do is really reality TV at its best. So you kind of have to discount what's out there. And the problem is people who do watch those shows actually do believe that.
Yes.
And it sort of carries into the professional offices, which this is not reality TV. But it is good TV. It's Samsung production TV. And we welcome interested comments or questions on how we can better inform you and entertain you. Remember, you're watching It's Your Health, your leader in healthcare information. Thanks for joining us. See you again next time.